Alright, in this video I'm going to be doing inspection, palpation, active, passive, and resistive ranges of motion on his shoulder. So I'm going to start with inspection. What I'm looking here is if I find any redness, bless you.
Thank you.
Yeah. Okay. Perhaps some atrophy, hypertrophy on one side and or the other. And then I'm going to be moving into palpation. I always start with temperature check, seeing if one portion of the shoulder is more warm, and this is a little bit more warm. Then I'm moving on to palpation. Start with superficial palpation on bony structures and soft tissue. Is that tender right there? Alright, I'm going to go deeper. Yeah?
Yeah.
Alright. Checking his acromion, clavicle, scapular spine, the muscles around that area of the shoulder, the sits muscles, the acromion, the corporate process. Was that any of that tender?
No.
Besides that point now? Okay. Checking the other side. Is that tender?
No.
Alright. Perfect. And then I'm going to be moving into active range of motion. Go ahead and stand up. Thank you. And first, I'm going to check for flexion. You're supposed to do this bilaterally. First, if one of his shoulder hurts, I would do it on the non-involved side. Do any of your shoulder hurt?
No, sir.
No. So always remember that. Start on the non-involved side. So if he had said yes, my right shoulder hurts, I would start on his left shoulder just to see what's normal compared to the other side. But for the sake of time, I'm only going to be doing it on one shoulder. Go ahead and with thumb pointing forward, bring your arm all the way up. Perfect. Stationary arm is on body, moving arm is on mid-humerus, and he has 180, which is normal. And then go ahead and bring it back to neutral, and then extend it all the way back. Extension, he has, keep it like that. Okay, he has 67 degrees. For abduction, go ahead and bring your palm up, open like that. Perfect. And then bring it up into the ceiling. No, so to the side. What I want you to do is go ahead and put it back to normal. So you're going to bring it up like that. Okay. Abduction has 160. Normal is 170 to 180 degrees for abduction. For flexion is 160 to 180. For extension is 60 to 100. Abduction 170 to 180. And then adduction normal is 50 to 70 degrees. So go ahead and put your palm forward like this, and then so you're going to bring it across your chest. So you can actually sit down for this one. So without bending your elbow, try to bring it across. Right, go back to neutral. Right, so forward, just like that. And now go ahead and move it. Okay, 50 degrees, that's normal. Did any of those movements bother you?
No, sir.
No? Alright. So for internal and external rotation, go ahead and stand up again. Thank you very much. And bring your right arm like this. So arm is abducted to 90 degrees, elbow is flexed to 90 degrees, palm is down, or palm is down. What I want you to do is go ahead and, without moving your without moving your elbow, bending your elbow at all, just bring your palm down, just like that. Okay? 60 degrees. Now go back to neutral. Okay. And Try to bring your palm up, back to neutral, please. Thank you. And bring it up. Sorry, back to neutral. Let's do it slowly. Try to keep your elbow in that position. All right, bring it up. All right, you can stop there. I'm asking him to stop because he started to move his elbow. So just to make sure that's 60 degrees. All right, perfect. You can take a seat. So normal values for internal rotation is 60 to 100 degrees, and external rotation is 80 to 90 degrees. So did any of those bother you? No? So now I'm going to be moving into passive range of motion. So now this time I'm going to be moving the shoulder for you, okay? Go ahead and relax. All right, does that bother you? Feels like tissue stretch. Extension, does that bother you? Tissue stretch. Abduction. Does that bother you? Tissue stretch. Palm up. Does that bother you? Tissue stretch. Okay. Go ahead and do that. Does that bother you? Tissue stretch. Does that bother you? Tissue stretch. Okay. So now I'm going to move on into resistive ranges of motion. This time, I'm going to ask you to do that motion. I'm going to try to block you, and then you're going to resist my motion, okay? So try to bring your arm with your shoulder pointing up. Try to bring it up into the ceiling. Oh, sorry. So do it again. So try to bring it up. Up. Does that bother you? No. All right, now try to bring it back. Try to bring it all the way back. Does that bother you? No. Okay, palm up like this. Now try to bring it to the side, up all the way up. All the way up. Does that bother you? No. Okay, and then bring it forward here, up like that. Try to bring it to the side like that. Right. Does that bother you? No. Perfect. Go ahead and bring your arm to the side, elbow flexed. Try to push your hand up. Does that bother you? No. Now try to push it down. Does that bother you? Perfect. So that's inspection, palpation, active, passive, and resistive range of motion. Okay. So this next test is called the Apley's scratch test. So what I want you to do is go ahead and with your right arm. First of all, does any shoulder or arm bother you? No? Okay, so go ahead and take your left hand and reach across your neck into your opposite scapula, which is this bone right here. Alright? Is that the most you can do? Yes. So I'll go ahead and mark that point, and then go ahead and relax. Take your hand up, and then with your opposite hand, again, reach across your neck to the opposite scap, and then relax. So him is pretty equal, good for that. And then now, sir, what I want you to do is go behind your back into the opposite hand. Like that, perfect. All right, and do it with your opposite hand. All right, perfect. So here he had about an inch difference, which is fine. More than an inch would be positive for a glenohumeral joint restriction or tight muscles. Now what I want you to do is go ahead and bring your left hand back into your opposite scapula, which is this bone right there. All right. Go ahead and do it. Perfect. And now do it with your opposite hand. And perfect. And here, and that's about equal. So this is a negative test for him. More than an inch difference. Could be tight muscles or glenohumeral joint restriction. All right. This test is called passive glenohumeral abduction with scapular palpation. So, sir, does any shoulder bother you at all? No, sir. No? Okay. So always remember starting the non-involved side. But since he doesn't have any, I'm just going to start with his left. So I feel the inferior border of the scapula. Give me your arm. Okay, there it is. I grab it. And then, now I'm going to be moving your arm around. Let me know if you feel any discomfort, okay? Alright. Relax. Let me do it. Alright, there it starts to move. It's about more than 80. Yep, around there. Now I'm going to compare it to the other side. I'm going to be doing the same, okay? Relax. Alright. There, just about more than 80. So in this case, it's not a positive test for him. It normally the inferior angle of the scapula should move between 70 to 80 degrees. If it moves before that, then it would be a glenohumeral joint restriction, specifically scapular restriction. All right. All right. This next one is called passive humeral abduction with glenohumeral palpation. So does any shoulder bother you? No? So always starting the non-involved side first. I'm going to feel the humeral head. I'm going to be moving your arm around, let me know if that causes you any discomfort, okay? So I'm pressing, or I'm palpating his glenohumeral joint and how it moves in relation to his acromion. I'm palpating his humeral head and how that moves in relation to the acromion. Alright? Go ahead and relax. I'm going to be moving your arm around. So what I should feel is that the humeral head drops inferior in relation to the acromion at around 70 to 80 degrees, which in this case it does. So that's good. I'm going to be doing the same on this arm. And again, the humeral head dropped forward around 7. Let me do it again. Around there, so between 70 to 80 degrees. If it moved before, that would be positive for a glenohumeral joint restriction. Okay, so this next test is called Speed's test. So what I'm going to ask you to do, first of all, does any shoulder bother you? Okay, so remember always starting the non-involved side. Go ahead and put your palm up and raise it just about that level. That's pretty good. So I'm going to be palpating his occipital groove, and then I'm going to be applying pressure here. I'm going to try to push your arm down. Try to hold your arm right there, and then I'm going to try to push it down. Okay? Does that cause you any pain? No. So if it does cause any pain, we would turn the hand like this, and then hold your arm there, and then try to push it down. Does that cause you any pain? No. Okay. This test would be positive if pain is felt over the occipital groove, and that's indicative of occipital tendinopathy or strain. Now I'm going to do it on the other arm as well. Go ahead and put your palm up. All right, I'm going to push down here. Does that cause you any pain? Okay. Resist. No? All right, so that's Speed's test. All right, this next test it's called Yergerson's test or supination sign. So, sir, does any shoulder bother you? No? So always start in the non-involved side. What I want you to do is go ahead and put your arm like this. So, and then what I want you to do is try to rotate your hand like this and push your arm out. You're gonna rotate and push out. Okay? So like that. All right. And then I'm gonna try to resist that motion. All right. I'm going to be palpating over the his occipital groove. Okay. Now I'll try to do that motion. All right. Does that cause you any pain? No, sir. No. All right. I'm going to do that on the other side as well. All right. Try to do that motion. Okay. So remember, double flex like that. All right. Now try to do it. Pain? No? So, two things here. If this test is positive, if he has pain over the biceps groove, and that would be indicative of occipital tendinopathy. Also, if I, as a clinician, feel that the ligament moves out of place, that's also a positive test and would be indicative of a transverse ligament tear or instability of that ligament. Okay, this next one is called the transverse humeral ligament test. Does any shoulder bother you at all? No? Okay, so I'm going to be exposing you to your shoulder. Is that okay? I'm going to be moving your arm around. Let me know if you feel any discomfort, okay? All right, sleepy? Okay, sorry. So I palpate his vestibular group, and then bringing his arm up like this, and then I'm trying to do lateral rotation. I'm feeling for that tendon, the occipital tendon, or if it pops out of place, and then I'm going to do the same on the opposite side. That cause you any pain or discomfort? No? Alright. Alright, do the same. Positive test would be if I feel that the tendon pops out, and that's indicative of a problem with the transverse humeral ligament, or occipital tendon is just popping out. Alright, this next test is called the empty can test, also known as the supraspinatus test. So, does any shoulder bother you? No? Alright. So go ahead and put your arm out to 90 degrees, thumb pointing down, and I'm going to be doing this in the scaption plane, so about 30 degrees or so forward. Okay? I'm going to be palpating in the vestibular groove and then pushing here. Let me know if you feel any pain or discomfort. Try to resist that motion. Pain? No? Yeah, I'm going to do the same on your opposite hand. Again on the scaption plane. And resist. Pain? No? Alright, so what I'm looking is for pain around the superior humeral head or around the anterolateral portion of the humerus there, and that's indicative of a supraspinatus tear or some sort of tendinopathy of the tendon. Okay, so this next test is called the lift-off sign or the Gerber's test. And sir, does any shoulder bother you? Any pain at all? No? Okay. So what I want you to do is with your left hand, make a fist, put it behind your back, and then try to go ahead and rotate it out like that forward. And then resist my motion. I'm going to try to push it, and then don't let me. Okay, that's good. Now do the same with your opposite hand. Resist my motion. Okay, good. So if he wasn't able to resist the motion, or if his hand would be, if his hand would move back like that, or if he just didn't have any strength, that would be, or if that caused him pain. Did that cause you pain?
No, sir.
No. If that would have caused him pain, or if he couldn't move it forward, that's indicative of a subscapularis tendinopathy or tear. Alright, so this next test is called modified liftoff. It's also called the medial rotation lag test or the medial rotation spring back test. Alright, so sir, does any shoulder hurt at all? Any pain? No? So I'm going to be moving your arm around and let me know if that causes you any pain or discomfort, okay? So I'm passively rotating his shoulder back, and then rotating it out. So what I want you to do is I want you to hold that position, okay? So I'm gonna move it back and hold it. I want you to hold that position. So I possibly do it. Okay, let me try that one more time. Okay, that's good. I'm gonna do the same on the other side. You can relax this time. Okay. Move it back. So hold it. Alright, that's good. So if his hand would move back like that, if he wasn't able to hold that position or he had pain under his subscapular area, that would be positive for a subscapularis tendinopathy or tear. Okay, so this next test is called the lateral rotation lag sign, also known as the infraspinatus spring back test. Okay, so does any shoulder bother you at all? No? Okay, so I'm going to be moving your arm around, let me know if that causes you any pain or discomfort, okay? So let me do it for you. So I'm gonna bring his arm to 90 degrees in the scapular plane. Then do external rotation all the way back. So let me do it for you. There you go. I want you to hold that position. All right, and try that again. All right, good. I'm going to do the same on the other side. 90 degrees of abduction in the scapular plane. External rotation all the way. Hold that position. All right, that's pretty good. So if his arm if when I asked him to hold the position, if it would jump forward, if he wasn't able to hold that position, that would be a positive test, and it would be indicative of a supraspinatus or infraspinatus, also teres minor, strain or tendinopathy. All right, so this next test, it's called the inferior instability test, or also known as the sulcus sign. So, sir, does any shoulder bother you? No, sir. No? Go ahead and lean forward just a little bit. Perfect. Then I'll be moving your arm around. Let me know if you feel any pain or discomfort, okay? Attraction this shoulder arm down. I don't see any sulcus. Do the same on the opposite side. Perfect. And absent sulcus. The sulcus will appear around this area. The presence of a sulcus is indicative of inferior instability or multi-direction instability of the shoulder, glenohumeral joint. You classify the sulcus as a +1, +2, or +3. A +1 is anything sulcus that's about 1 centimeter in diameter. A +2 is between 1 and 2 centimeters, and a +3 is anything greater than 2 centimeters. Alright, so this next test, it's called the load and shift test. So does any shoulder bother you at all? Perfect. So what I'm going to be doing is I'm going to be pumping your shoulder, let me know if you feel any discomfort, okay? I'm going to grab the humeral head, push it into the fossa, and then push it, bring it anteriorly, and relax. And then grabbing the humeral head, pushing it into the fossa, posteriorly, relax. Does that bother you? I'm going to do the same on the opposite side, pushing the humeral head into the fossa, anteriorly, relaxing, humeral head into the fossa, posteriorly, and relaxing. His glenohumeral joint is fine. A positive test would be excessive translation of the humeral head, and that's indicative of a glenohumeral joint instability. It's graded in grade 1, grade 2, and grade 3. Grade 1 is when the humeral head moves in either direction, anteriorly or posteriorly, up to 50% of the humeral head diameter. If it moves beyond that and is able to return, that's a grade 2. A grade 3 would be moving beyond 50% and then remaining in the dislocated part. So this next test, it's called the nearest impingement test. Sir, does any shoulder bother you?
No, sir.
Okay, so what I'm going to do is I'm going to be moving your arm around, let me know if that causes you any pain or discomfort, okay? Okay, so what I'm going to do, I'm going to do it this way. So in the scaption plane, your hand relaxed, I'm going to be moving your arm around. So in that scaption plane, let me know if this bothers you, okay? Does that bother you?
No.
Okay. Do it on the other side. Relax. And does that bother you? No. So pain on the anterior portion of his shoulder could be indicative of a subacromial impingement syndrome. Okay, so this next test is called the Hawkins-Kennedy test. Alright, so do you have any pain in either shoulder?
No, sir.
No? Okay. So what I'm going to be doing is moving your arm around, let me know if that causes you any discomfort. Okay, so bring your arm forward here like that. What I'm doing is stabilizing the scapula down so that the glenohumeral joint does not move. And then I'm going to apply some pressure here, okay? Let me know, so hold this position. Let me know if this bothers you. Does that bother you?
No, sir.
No? Alright, I'm going to do the same on the opposite arm. Remember to do this in the non-involved arm first. Stabilize, so hold this position right there. Hold it. Alright, does that bother you?
No, sir.
Okay, so pain at the anterior shoulder would be indicative of a subscapularis impingement, possibly supraspinatus impingement as well. Okay, so this next test is called the subacromial push button test. And sir, does any shoulder bother you at all? No, sir. So remember to always start in the non-involved side. So what I'm going to be doing is just basically palpating the shoulder, trying to find the subacromial bursa. What I do is I go into the deltoids, looking for point tenderness under the acromion, under the coracoid, back here. Does that bother you at all? No, sir. Okay. Do the same on the opposite side. Okay. Does that bother you at all? Alright, so localized pain, if he's able to point it to it, it could be a positive push button test, possibly subacromial bursitis, or it could be something going on with the muscle as well.